Hello, welcome to Adapt and Place, and thank you for deciding to watch this video. So I'm going to do a series like 3-part videos to help you guys with the infectious disease, the specific disease process that they are. Some of them are communicable disease, some of them are reportable diseases, but there's few of them. So let's take a ride. So I'm going to start with chlamydia. This is something that you have to know for your test. So chlamydia, and what organisms are involved and how does that play a role. This is caused by a bacteria. So it's a bacterial problem. And it's caused by organism called Chlamydia and Trichomoniasis. That's the name of the bacteria, usually involved in what we call pelvic inflammatory disease. By the location where they affect mostly is in the vaginal discharge. These are some of the symptoms patients will show. You have the vaginal discharge, and these discharge they can also have some bleeding, especially after sex. Post sexual in contact. It can be painful during sexual activity or when they're urinating. So painful or frequent urination. And they can also have abdominal pain, but this is abdominal pain is located in the lower abdomen. And they can have fever, some nausea, some GI symptoms. Some of them, most of them are asymptomatic. So that is a key that you have to know. People walk around with chlamydia, and you never know, and then you get infected by. This is the symptoms in mostly women. For men are usually symptomatic. Okay, so this is for men. They're usually symptomatic. They have a small amount of clear, thick discharge. Some of them are very thick and cloudy. Urinary discharge or penile discharge. This can be very painful, and they can also have dysuria, like the female. So they have the dysuria. And what they don't like is a swollen testicles. They don't like it at all. They can have lymphadenopathy also associated with that. And so this is a very common, but is sometimes the female and with the women hide it. What is the complication with this problem? And as you can know, this is usually sexually transmitted. What is the complication about this? This is the key for your testing and for education of people involved with this problem. Of course, sexually transmitted, and you can pass on to your neonate too. Baby can get this problem during childbirth. And what would they present? They may have conjunctivitis, um, conjunctivitis. They also have pneumonia. That's why we treat this, we check this during pregnancy and make sure you don't have it. The major complication for female is a pelvic inflammatory disease, PID. So, and this is where there is scarring of your fallopian tube. And that can lead to like ectopic pregnancy or infertility. This is key for the women. So that's why we treat this problem so that you don't progress to that. For male, of course, it can lead to them being sterile. They cannot have sterility in men. They can't have babies. Basically, their sperm is non-infective now because of the scarring or all that's vast difference. So this is a problem. You have to know the organism involved, how it's transmitted, presentation, and then the complication. Of course, we have treatment for that, right? We have treatment that is very effective. That's why we ask people to seek help so that they can be treated. So treatment is very straightforward. What do? We try to say HEP is oral antibiotic. You need an oral antibiotic. And usually we treat this in combination of to gonorrhea. So, but most of the time you get cyclines, those doxycycline, and that can be effective. Or they can give you azithromycin. Okay, and it's very important to treat the individual so that they don't pass it to their partner. In order to prevent neonatal transmission during birth, what we give the patient, this is why we give erythromycin. You have to know this in kids. As soon as they're born, we give them erythromycin ointment to prevent their conjunctivitis in both eyes in 1 hour. It has to be, this is key. 1 hour. We have to give you this in the first 1 hour of your life in order to prevent that problem. So erythromycin in both eyes in 1 hour to prevent pneumonia or conjunctivitis in the kids. So that is the first organism. As you can see, there is no ulcers. So if you have a question that is talking about it, they don't have any genital, there's no ulcers at all. That's why they can hide. The key is discharge in the vagina and the penile area. Okay, so that's the first organism you need to know about, chlamydia. So our clinic. The second one is gonorrhea. It's good to do both at the same time so that you can see it. And usually we think they occur simultaneously. The different though, this organism is also bacteria. His name is Neisseria. Okay, Neisseria gonorrhea. It's a bacteria. It's also transmitted by sexual contact. Symptoms usually will appear 2 to 21 days after infection, so you will not know it post-infection. So you don't know it until a couple of weeks later or days later before you know that you've been infected. For men, how they present is it's very yellow, thick, greenish secretion. They didn't like green penile discharge. The other two, they can have dysuria. Symptoms look like the same as the chlamydia. Even with bowel movement, they can have pain with bowel movement because of the inflammation in the pelvic. They can have frequent urination, so they are like UTI-like symptoms. And the testicles can also swell up, so swollen testicles, which is almost like epididymitis. So they can have inflammation of the epididymitis. Epididymitis is the tissue that lay on top of the testicles. If this is the testicles, I call it the testicle hat. It's on the top of it like that, like adrenal gland. And then they can get inflamed, very, very tender. For women, the symptoms is very pronounced. You have yellow, also greenish and discharge. Sometimes it may be gray in color, okay? But it's very, very malodorous. It smells. You see, it's a fruity. It's a lot. Okay, it's a lot of it. Discharge that they can get. They can also get a vaginal bleeding after sex because of the inflammation. The symptoms can also look like gonorrhea, And so the same thing, you can have dysuria also. That's why it's hard to distinguish between them, and you have to do some courses to be able to make the diagnosis. As you can see, this gonorrhea and chlamydia, they affect the upper portion of the genitalia. So they serve they go into the cervix, the upper portion of the tubes, the fallopian tubes, and so they're different from those that affect the lower portion of the genitalia area. Okay, the treatment is almost the same. Okay, let's talk about the complication. Major complication is, they can also have a pelvic inflammatory disease, PID, and then that can lead to infertility in the female. Okay, it's very, very important. It can also causes problem with the transmitted to the baby during birth. Neonates are always in trouble. This is why we check all this thing. The neonate can get into trouble by when the mommy has gonorrhea. And what they have is mostly ophthalmological problem, the eye problem. So ophthalmia, neonatal, okay, basically. That's this problem they can have. Men can also have infertility. The same thing as the female. So this is a problem that we want to prevent as much as possible. All of this, chlamydia and gonorrhea, both are reportable. You got to report it to the authorities, figure out, so that we can keep track of them. Patients getting treatment as much as possible. Treatment, usually injection. So the first line is IM and Ceftriaxone. So it's a penicillin derivative problem. So you got to check whether they are allergic to penicillin. That's the first line treatment. Like I said, we try to treat them together with chlamydia, so they get azithromycin or doxycycline and to treat the chlamydia. So let me make a statement. This is very important. If you have chlamydia, we treat you just for chlamydia. But if you have gonorrhea, we treat you both for chlamydia and gonorrhea because they can be co-transmitted. The likely of co-transmission. So if you just have a chlamydia, we treat you with the doxy and azithromycin. But if you have gonorrhea, we think that you also may have chlamydia, co-infection. So we treat you both of them. Okay. Same thing. In order to prevent it in kids, they get erythromycin ointment first hour of birth in both eyes to prevent it. So those are the two common upper genitalia infection organisms. Are both bacteria. They all have malodorous discharge, yellowish thick and discharge, cause cervicitis, cause uritis, cause epidermitis, and it's very painful, has very serious complications that you need to know. And then it can also affect your baby. So we got to treat you to prevent that as much as possible. Okay, so that's the second one. The third one affects the lower portion of the genitalia, so HSV. So this is the genital herpes. Okay, so that's genital herpes. Usually is transmitted from infected individuals. It's sexually transmitted, basically. An organism is a virus. It's not a bacteria. So you have to know it's a virus. You know that viruses, you can't get rid of them. So they can be, they can stay in your system forever, and so you can get recurrent infection. That is why you can get recurrent infection in these people. So we keep on treating them, and sometimes we put them on prophylaxis. Most people are asymptomatic in women, but they can get a outbreak. When they have outbreak of this problem, when they have the outbreak on this problem, you know they usually have like blisters and so vesicles, so they can have blisters and on the genitalia area in their mouth and mucosa areas, but mostly in the genitalia area. And they can also have like flu-like symptoms. Classic with heavy viral infection like body aches. Their lymph node can get bigger. That's lymphadenopathy. That's a LAD. So enlarged lymph nodes. Okay, this is the very, very important. It's the same thing like you can, when you get recurrence, it look like zoster. It's the same thing. So recurrent problem look like zoster. Somebody who have a chicken pox, and then they have a epizoster. So this one is very, very painful. Very, very painful. And then it's like a shooting pain in the penile area, and then it goes away. But that's how they get a recurrent. The blisters can last for like 7 to 21 days. That's the blisters. So just be careful in terms of, it's very important in terms of transmission. The presentation is the same for male and female. They have genitalia, they have blisters there, and that also can recur, and it's very painful. Complication that they can get from this, like I said, there's no cure for this problem. We just give you prophylaxis. That means you take something to slow it down. And then you can pass it on to your kids too, childhood and the neonate. Okay, because that's why we strain it. If we see active disease and during birth, before childbirth, this is a mandatory for C-section. Okay, we can't let the kid pass through the vaginal canal with active genital herpes. There's no way. Okay, and the medication we can use is antiviral. So antiviral, and this is what people take, Acyclovir. That's the most common cause of the medication that you can use. Sometimes they give you valacyclovir. It's the same thing. So for us, you see an answer choice that is via, it's always an antiviral. And this does not prevent infection. All it does is slow down the duration. If it's going to last for 7 days, probably will get you to 3 days. So it just shorten the duration and then prevent outbreaks. Okay, but it does not cure it. It does not cure it. It prevents you from having multiple outbreaks in a short time. At the same time, it slows down when you have outbreak. It helps you with the duration. Like I said, C-section is mandatory. Okay, C-section mandatory if there is active disease. You don't want the kid to be infected. Okay. If the mommy has this disease and is have active disease, yeah, we can start antiviral like at 36 weeks. At 36 weeks, in order to prevent outbreaks or mommy getting sick. At antiviral 36 weeks to prevent outbreak if they have prior disease of this. Okay, that's for the female in order to prevent further infection in the mother. And this is usually that's common. The other thing they can test you is if there's an active disease, well, no sexual contact. Okay, no sexual contact. Don't do that because it can get infectious until there's no vesicles anyway. So you got to like protect yourself in order to infect your partner. Basically, very, very key information to prevent infection of the partner. And so you have to teach the individual that, hey, there's active lesion, avoid sexual contact, sometimes 7 days until all the disease process is gone. Okay, so that is herpes. These informations are usually raw, they are not fun. Okay. So HIV is another infectious disease. This is also caused by virus. We all know that, right? And it can symptoms appear several months, sometimes weeks after infection. Okay, weeks and months after infection. Though that's why people don't know about it, like I've been exposed or anything like that. But when it happens, we call it acute viral syndrome. It's not classic. It's classic, but it's like any viral infection. It's non-specific. You get this fever, you get body aches, non-specific. Your lymph node get bigger, then you get rash. And this rash is macular papular rash. In your body. So it's non-specific. This is that's why you can't tell if you're infected. You don't know. People just basically forget it. But that's the key aspect of it. It's non-specific. When you become more prominent, yeah, we got to do so many tests to figure out. But this is some of the classic signs and symptoms. There's no specific until you are full-blown AIDS. So HIV infection is not the same as AIDS. AIDS is when you become immunocompromised and you have viral load that is very, very high and CD4 count less than 200. Yeah, that's, but you can get infected with HIV and never develop AIDS if you are on your medication. Okay, there's no cure. So no cure for this, like any other viral infection, but it's treatable. So you got to get help to be treated. And then, like, this is transmitted to sexual contact. Okay, needle sharing, even can give you birth. You can pass it on to your baby. It's very common. Breastfeeding also, you can transmit it to that. And in your blood too, of course. There's no ulcers in the genitalia. So if they give you a question and you're trying to figure out whether this is HIV, look for ulcers. They don't have ulcers in their genitalia or anything like that. They have rash in the body, but there's no like specific ulcers in the body that you got to look for. In terms of treatment, we monitor your CD4 count. And we want it to be greater than 200. If it's less than 200, you have developed HIV. And so we have to put you on medication and so in order to, some people take prophylaxis, but this is the medication we call but it's basically antiviral medication. That there's a bunch of them. There's a bunch of combinations that they can use prevent the disease. All of them have complications. It's very important that you understand that it's not just one medications, and these are given depending on what stage you are. But every combination is different. There's those that affect the enzymes, those that basically affect the virus itself. But I don't need to list them. I don't think they'll ask you too much about the specific medication. But no, just know say antiviral medication to help with the infection. Okay, and that's the HIV portion of it. Then we can have another organism is HPV, human papilloma virus. Okay, this is also very important. You see it all the time. This is the genital ward. Okay, it's also a virus as usual. Therefore, it can no cure. You can't cure it. You keep on having what recurrent infection. What do you see? Okay, what do you see in this patient? You see something like cauliflower-like lesions, a small, freshy cauliflower. Lesion. You can see it in the genitalia area. You can see it in their hands. Some on the rest, some on the skin, but most common is in the genitalia area. That's the herpes, basically. HPV. Okay, this is some people you hear they call it condyloma. It's the same thing. It's the same thing as condyloma. And they form together cauliflower-like lesion. They burn. Okay, so that's why they seek some help and they look unsightly. Okay, you can also itch. This is why we do pap smear to look for them in the cervix, because they can lead to anal cancer or cervical cancer. Okay, that's why we look for them. And it's passed on from one partner to another. So your partner can pass it on to you. You can also pass it on to your baby neonate. There's numerous strains. So there's a bunch of them. There's different kind of strains. So you can't even control them. So many of them that you have to know. You can inhale it, and it can cause lung problem. It can cause respiratory, what we call papillomatosis. So that's why when people deal with this, wear special masks like N95 and to help with that. There's now a vaccine, Gardasil. So that young men can take like 11 to 12 years old. I think it has also been extended to people who are 40 years, can also get it. Recent extension in your test, I don't know which one. 11 to 12 has been what has been known for a long time. Like recently, it's been extended to people who are 40 to help with that, since they did not get it before. And then you can give it to the 11 to 12 is for boys. So 11 to 12 is our boys, and the girls before they're 9 years old, they will be eligible for that. If you have infection, they can burn it. They can freeze it. But there's specific medication, pedophilia. This is topical agents that we can use to destroy the lesions, okay, or imiquinine. I don't think they will bother you too much, but these are the two big medication you can use to freeze it and apply topical. These are all topical agents. And this one is just basically local control. Okay. And then the syphilis is very notorious. It's caused by bacteria, and the bacteria name is Trichomoniasis palladium. It's easy to treat. It has 3 stages. Either 3 or 4 stages, because we don't, sometimes you ignore the latent stage. So the early stage is called primary syphilis. And usually you have a sore in your genitalia. This is painless. It's not painful. This is what we call the chancre. You can have it on your mouth also. But this sore can last to 2 to 6 weeks. So when people ignore it, it's very small, it's not painful, they think something normal. So they don't do anything about it. It just get ignored without doing anything about it. Right? And then it goes away. And you go to stage 2. Stage 2, after 6 weeks, all of a sudden, you have like flu-like symptoms, and your lymph nodes are bigger. You have rash, maculopapular rash. In your body, your hands, and the soles of your feet. When you see that, yeah, this is secondary syphilis. This is very contagious, infectious too. So this is very infectious. The primary syphilis is also very infectious. And this is where people usually seek help. They come in because of now they have flu-like symptoms. The lymph node is bigger. They have rash. They have maculopapular rash, and then they're very infectious. They get sick. Okay, then they get better. In the latent stage, they have no symptoms at all. So if they try not to come in to be treated at this stage, and they go into latent stage, then a couple of months, years, they will develop tertiary syphilis. This is bad. Now the bacteria has stayed in your body, is causing problem. So they develop some cardiac issue. They have neurological issue. It's not good. And so then they have skin, cutaneous lesion on their skin. These are complications that very, very important, that you can see, that you can tell that patient is not doing well. So it's good to know which stage, primary, what kind of lesion you see, and stage 2, how they present, latent state, and tertiary state, because they will ask you what stage is the individual in based on the symptoms they provided you. So pay attention to that. Okay. This is sexually transmitted. It's passed on from one partner to another. And so you can see the stage 1, stage 2 is the most infectious stage. The tertiary is not that great because now they've developed bad disease. So you have to treat it. Once again, neonate. Transmission is also possible. It can cause miscarriage. That's bad. It can also cause blindness in the kid and brain death. So we try to treat you. We try to treat you to prevent all these things. The lab work they will do is RPR. Okay, that's the common one. They usually they check to see if you have infection or not. So look for that. Treatment is very straightforward. You just get a penicillin G. Is the drug of choice. There is this is the best drug. So some people who are allergic to penicillin, we have to desensitize them. To give them the penicillin G, because this is the most effective treatment out there. So, what will happen? They will desensitize you and give you small doses of the penicillin to see if you react. Then they'll give you, because this is the most effective medication we have. So we don't want people to be allergic to that. That's the only thing that can treat it well. So when you see it in the question, yeah, that's what they're referring to. Desensitization. You can. So if a pregnant lady need the penicillin G because she has syphilis, well, it's deadly for the baby and it can cause problem, and therefore the mother has to be desensitized so that we can give them penicillin G. Okay, so we have two more here. This one is trick. I call it trick. Okay, Trichomoniasis. You know what it is. Some people call it trick. It's the same thing. Usually infected by partner, okay, sexually transmitted. Okay, 3 days after the infection. Sometimes it can get like 2 weeks after the infection. You can be most women or men, they can be asymptomatic. So some can be asymptomatic. They don't know. But if they have symptoms, what they will show is they have like yellowish, greenish, fruity, like gonorrhea, mucopurulent. It smells really bad. So mucopurulent, copious, a lot of it, discharge. It's like a floodgate. They can have dysuria, painful urination. They can have dyspareunia, that is painful sex. All of them, syphilis, gonorrhea and chlamydia can also do that. They can itch, okay, irritation, they can bleed. Those are some of the symptoms you can see in them. Male do the same, a lot of discharge, painful urination, similar to the female. We have to treat the partner, okay? The complication is just like, there's no big complication in the woman. The men, yeah, they can get prostatitis. So that's why we got to treat them. So the common treatment is metronidazole. That is very effective to treat it, both the partner, and if you're pregnant, yeah, we can still give it to you. If you're pregnant, we can give it to you, but only in the first trimester. Okay. Due to the medication. Remember, metronidazole, you got to teach them they cannot drink. If they drink, they are in trouble. So that's flagyl. It's also a sulfur drug. So all those things you have to give the patient instructions to follow up on it in order not to get sick. And this is one of the things you have to tell them, because they don't know. They'll go and drink and they will get really sick from it. Okay. And lastly, I think it's good to add this to that. Mononucleosis, called the kissing disease. This is the kissing disease. It's found in like college students, because basically they go out and kiss each other, okay? And they pass on the organism from one another to another. mostly oral, but it can also occur in your blood and in blood products. But mostly, I need to put asterisks there. Mostly is oral. That's why we call it kissing. But it can also in the blood. The organism is a virus also, and it's Epstein-Barr virus. That's what we call it. That's the name of it. Okay. Incubation period is long. It can be like 30 to 50 days. That means you kiss somebody, a month later, everything's all swollen. You find in, like it's a young kids, and the presentation is, you see, they usually have body aches. Okay, they have sore throat, pharyngitis. They can have fever. Their lymph node is huge. Okay, they can have fever and headaches. It's non-specific, and sometimes rash. Okay, it's non-specific, so you got to figure out what is going on. Usually, it's not that specific, so it's hard to make a diagnosis. But based on their lymph node and what they complain about and how the symptoms started right away, you can figure out that this is the problem. There's no big treatment. It's usually supportive care. So hydration as much as possible and some pain medication to help. But the history will give you idea. If there's a case form, you can tell that it will rule out other symptoms. That some kid went out, they'll give you story party, and they came home all of a sudden, body is aching, sore throat. Okay, they have sore throat, and then you know that this is the problem. What is the major complication? So spleen get enlarged. Because of that, you got to pay attention. No contact sports. So if you are a sports guy, rugby guy, and you go and kiss somebody and you develop this, no contact sports for 14 days. 14 days. No 13. 13 and a half is still wrong. This is wrong. Exactly 14 days, you cannot have any contact sports. Because if somebody bang you in your abdomen, you have your spleen that is ruptured. So in your B-sharp moment, anybody with the mononucleosis that is complaining of abdominal pain, you should see them. This is number one patient, it's hemorrhage. Mononucleosis complaining of abdominal pain, you have to see them. Mononucleosis, playing sports, 10 days after the disease, number one, I got to see them. So that's the key fact you have to know. You have to be 100% sure that they are not doing any contact sports. Otherwise, they will bleed and they will get into trouble. Apart from that, supportive care, lozenges to wash their mouth, salt and goggle, and then that will take care of the problem. Okay, so this is the first portion of it. I think it's very inclusive. Next time I will do the kids, all the kids infectious disease and party together. Take care of yourself and thank you for watching. This is just to give you an idea in case you see these questions. Sometimes they ask you organism, how do you manage it, medication, what do you expect and what do you teach them, and they have to compare. They'll give you a table and you have to compare each other. And so this is your companion to look at it and help with that. Thank you very much and all the best of luck.